Okay, the next section here is Chapter 9, which is Sexuality. Okay. Sex is the physical activities involving the reproductive organs, and basically, sexuality is the physical, emotional, social, cultural, and spiritual factors that affect a person's feelings and attitudes about his or her sex. Sexuality involves the personality and the body. Sexuality is important throughout um, a life because residents are viewed as whole persons who have love and belonging, self-esteem, and self-actualization needs. Sexuality again involves the whole person, but illness, injury, and aging can affect sexuality. Again, sexuality is important throughout life, and attitudes and sex needs change with aging, and again, they're affected by life events. All right, there's different types of sexual relationships. There's the heterosexual relationship, which is between members of the opposite sex, homosexual, which are attracted to members of the same sex, bisexuals attracted to both sex, and so forth. And you can read over this, basically just wanting you to know the differences in the sexual relationships. But illness, injury, and surgery can affect sexuality, and it can affect sexual function in itself. So the sexual ability may change of a person. Most chronic illnesses affect sexual function, mainly either by the disease process itself or the medications the person that has to take for the condition can actually affect sexuality. Um, and anything like reproductive system surgeries also have physical and mental effects. Impotence or erectile dysfunction can occur in men, and then changes in sexual function just can affect a person greatly, depending on the person and the conditions that are happening. But as far as sexuality in older persons, love, affection, and intimacy are needed throughout our lifetime, and our reproductive organs change with aging. Frequency of sex decreases for many older persons. It doesn't mean it leaves or goes away, um, but it just decreases. Some older persons do not have intercourse, but that doesn't mean that they can't have intimacy. Sexual partners are lost through death, divorce, and relationship breakups. Um, and a partner may need hospital or nursing center care, which would then again affect the sexuality of the relationship of the persons. But remember that older persons love, fall in love, hold hands, and embrace, and many still do have intercourse. If you're aware of the changes in your sexuality you experienced during adolescence, those changes are changing as you progress in age and relationship, um, let's say abilities, but as your relationships mature. As far as meeting sexual needs, the nursing team promotes the meeting of sexual needs. If married couples are in nursing centers, they can actually share the same room. They can even share the same bed if their conditions permit. Single persons may also develop relationships within the nursing center, and they are allowed time together, and they're not kept apart. It's not a taboo type of things. When we're sexual beings, and this is part of who we are. That doesn't change with age. The sexually aggressive person, now some persons want the health team to meet their sexual needs. Behaviors can anger and embarrass the staff member, but trying to understand the reason for the person's behavior helps you kind of deal with the matter. Oh, excuse me, I'm sorry. All right. Let me think. I'm sorry, I lost my place here. Causes of sexually aggressive behaviors include nervous system disorders, confusion, disorientation, dementia, medication side effects, fever, poor vision, and changes in mental function. All can cause a person to become sexually aggressive. Okay. Understanding the sexually aggressive behavior, sometimes you have to look deeper than just the behavior they're displaying. They could have physically something going on causing them to act aggressively if they don't know how to communicate. If they have a dementia, remember the way they're communicating with you, they're trying to tell you something. It's not just because you're beautiful and they just want to jump your body. It's not that. Sometimes there's more to it than that. So sometimes touch serves to gain attention. So, if they pinch your butt or try to pinch your boob, that type of thing, those things do go on. You do have to be aware uh, of the person, and you learn these people pretty quick. And the staff will tell you if you have someone who tends to be sexually aggressive. Sometimes masturbation is a sexually aggressive behavior. Touching genitals could signal, though, a health problem, poor hygiene, or even being wet or soiled. So sometimes you just have to look deeper sometimes than the behaviors that they're showing you. You have to look deeper to see what else is going on. You can confront the person who does this and set boundaries. Sometimes the purpose of touch is sexual, but you have to be professional about the matter. Don't get upset with the person. Remain calm. Ask them not to do that, not to touch you. Tell the person that you will not do what he or she wants if they're asking for sexual favors. Tell the person what behaviors make you uncomfortable. I mean, if they're telling really rowdy jokes and that upsets you or that makes you uncomfortable, then just tell them. Most of the time, people, if you tell them to stop, they'll usually stop. Allow privacy if the person is becoming aroused, and you can always, of course, make sure that you report and discuss the matter with the nurse. For managing sexually aggressive behavior, again, if we do have someone who has some sexual aggressive behaviors, the care plan should have this on it. I mean, we have to care plan for measures to deal with the sexually aggressive behavior that the person is doing. Many centers have classes to help the staff deal with such behavior. The sexually aggressive person, they need the nurse's attention. So make sure that you report that and discuss it with the nurse, exactly what's happening, when it happened, what you said, and what you did. And then allow her to assess the situation and deal with the problem, because that's part of her responsibilities. And sometimes we have to do a trade-off. I'll have to take that person out of the aide out of that situation and put a different person in who's maybe not as attractive to the person, or at least can handle the situation better. It just depends on the situation too. As far as sexual abuse, we want to protect the resident from sexual abuse, and we want to protect you from unwanted sexual comments and advances, because both are considered sexual abuse. So make sure that you tell the nurse right away. Sexuality is part of the total person. Healthy, pleasurable sexual relationships and intimacy enhance the quality of life for people of all ages. So if you have in your facility, maybe you have a widower uh, and a widow, and they start have a blossoming relationship. They like to be together. They like to talk. They like to hold hands. There's nothing says that they can't, and we don't discourage it. We don't really encourage it, but we don't discourage it either or shame the people. This, as long as they're competent and they can make decisions, and if they want to sit together and hold hands, it's okay. You don't do anything. You just observe it, report, and record. That's all you can do, okay? Because it's not taboo. It's just trying to, people, again, are sexual beings. Now, I have had a situation where the gentleman was married, um, and the lady who took a liking to him really liked him. And of course, the gentleman had dementia. So they would hold hands. Now, we did have to kind of discourage this because the appreciate that he was holding hands with another woman. So that's a little bit a different situation going on, where we actually tried to keep those two a little bit more separated so that they wouldn't be holding hands, because he was already married. This was not a single relationship. This was a married single relationship. And of course, and the wife was, and we told the wife of what was happening so that she was aware. And things went pretty good for a while. They worked themselves out. But just to let you know that that really does go on in the facilities. And I have had married couples share the same room. Um, at the time, they both shared both shared a single bed apiece. It wasn't a bed that they shared together. But then I have seen where residents who are married share the same bed. So you're going to see all kinds of things when you're in the facility. Just letting you know. Well, this ends this chapter, and I will talk